Hello and good evening, everybody. This is the Harford County Health Department Minority Health Program, and welcome to another edition of Let's Talk About It. Tonight, we are really excited about our guest on tonight. We'll be bringing her up later on. And my name is Felicia Hopkins. I'm your host and community health worker, and here is our other care worker,
Michelle Peterson.
Michelle Peterson. We're your co-host for tonight. And we have some real exciting things going on at the health department. Um, I'm going to just try to take my time because I'm always kind of rushy. And so I'm going to take my time and give you some very important announcements. The first one is if you attended our not smoothie sip and but if you attended our crock rock throwdown when we were at the village at Lakeview, um, it was fantastic. Village at Lakeview, and we went to Windsor Valley. Shout out to Lalette Barmer. Shout out to Tracy Webb and the residents there that showed up. We had a fantastic time. Upper Chesapeake Medical, shout out to them because they came to our first one and they did blood pressure checks and a stroke analysis. A lot of people, 10 people, walked away with crock pots, and everybody walked away with sampling the food. Not only sampling, they got a full-fledged meal. Do you agree, Michelle?
Yes,
It was a
and it was
full-fledged
good.
meal.
It was
And it
delicious.
was wonderful. Chef Brown always does a fantastic job, and we just love her. So this month coming up, it is Women's History Month. And we're going to focus in on like self-care, um, de-stressing, things of that nature. We're going to be talking about other things as far as our health and cervical health, which is why we're on our show on tonight. Um, we're going to be doing a smoothie sip and paint, and I'm going to pull up the flyer so you can see it. We are going to be on. Okay, let me move us. There we go. There goes the smoothie sip and paint. There goes the information. I know that you might not be able to see it well, but that's okay. You can find this flyer on our Facebook page from the Harford County Health Department. Again, we're going to be having Michelle, tell them the stuff that you ordered. It's so nice. Go ahead and tell them what you ordered.
I'm over here messing up all of this. I'm turning off the camera. We're still new at this, but yeah. So at the smoothie sip and paint, we're gonna have. I'm gonna say it's gonna be a day and an evening because we're going to have two locations where we're going to have this event. So we're going to have about an hour to 2 hours of de-stressing while painting. And then we'll have some healthy smoothies to taste while we're painting. So far, I have some really nice paintings and I think it's going to be fun.
Yeah, they're really nice. They are really nice, and it's simple. Men, this is not just for the women. Michelle was thoughtful enough to make sure when she ordered something for the men too. So men, you can come and paint with us. The last year when we had it at the Epic Center, and it was almost like a wine tasting.
Yeah.
We had the cups lined up and people were coming and sampling them and saying, I want to try this one again and this one again. And you'll be able to take home the recipes as well. So listen, if you are listening to this broadcast and you are in the area, please make some time. There's some of you that might be retired, or you live in Windsor Valley and can get there between 11 and I think we have it from 11 to 2.
11 to 1.
11 to 1. Come out, hang out with us. We're going to have a great time. We always have a Kahoot game. It's not on the flyer, but we will have a Kahoot game, and there's first, second, and third prizes. And I wish we could have some people on just to attest to what is being given away. You're going to walk away blessed. You're going to walk away with some very good information. that you can about your health. Everything that we do is centered around the health data that we find out here that's important to us in the Black and Brown community for Harford County. Now, if you're listening to this and say, well, why is it just for the Black and Brown community? It's not just for us. We open this up to everybody, but we are highlighting the health needs inside of what we're doing for the Minority Health Program. So it's open to everyone. So I'm going to take this flyer off, but if you want to register, I would register so we know that you're coming and we know how much to prepare for. So the registration link will be on our Facebook page as well. So our next announcement, which I'm kind of excited about this too, is the Harford County Health Department. We've partnered with the Havre de Grace Rotary. They have a wellness series. We just hosted Dr. Kenny, and she's an anesthesiologist at Duke University. We just hosted her. We had over 80 people participate in that talk. And we are looking forward to more people joining us this Wednesday at 6:30 as we welcome Don Mathis. I'm going to try to move us off the screen. I don't know how I could do that. Let's see if we can present it another way. Don Mathis. I don't know. It's not going to work. That's okay. Don Mathis is a certified.
We got fancy with the premium package.
We're the premium. The premium package. That's hilarious.
We're trying to figure it out. We'll get it.
We're going to get it. We're going to get it. So the wellness series is presented by the Rotary Club of Harford County and Harford County and the Health Department. Don Mathis is a certified peer recovery specialist. And the topic that he's going to be talking about is very important out here. If you have followed anything on the social media pages, on the news, visibly on the news or in the newspaper, you know how important it is to be able to get a handle on substance abuse. And so his topic that evening is going to be substance use disorder and drug addiction in Harford County. He's going to talk about facts and solutions. You can come with your questions. I'm sure he's going to have information about the new detection thing that they have behind your ear to help you to, if you're in need of, if you're addicted to the point where you need something to help you to slow down or recognize that you're going too far, bring your questions. He's going to have the answers there. He's connected to Voices of Hope, and most of you know where that's located in Aberdeen, where the Ollie's is in the Epic Center in Aberdeen as well. So he's in that particular shopping center. So please, there's going to be a link. You can go on my page, Felicia Grant Hopkins, and the link is there as well. But you'll also be able to find it on the Harford County Health Department page, and press the link and join us, listening to what he has to say. I have to say, Don is a great conversationalist. So you're going to really enjoy the discussion. So our next announcement, and we are very excited about this, Michelle. We just made this flyer today. We want you to save the date. Because if you joined us in November, when we had the I, We, You Matter Youth Symposium, We Matter Youth Symposium for the young ladies, you know we loved them with some bathrobes, self-care products. They got water bottles. They got really good messages about depression and anxiety and talking about their feelings and emotions. The only thing we weren't able to do was finish up that panel. They did, we did SMART goals and
vision boards.
Right. We can't forget about the vision boards because we took so much time to be able to present that. But guess what? We are doing a part 2. Mount Zion Baptist Church, they reached out to us, and I'm so grateful that they did. They reached out to us and they said, could you bring this girls symposium to us? And we said we absolutely will. And so while I'm talking about how wonderful this one's going to be, I'm going to put the flyer up there. So save the date. Uh, I guess you can see it. So it's going to be April 21st. Again, if you can't see all of it on this page, let's see if I can move it. It says I can move it. If you put this date on your calendar, April 21st, from 6 o'clock to 11 p.m. Okay, it's not going to midnight this time, but guess what? Not only are we going to host you young ladies, not only are we going to finish that panel discussion and have some great girl talk, the parents, because the facility is so big, we can host the parents on one side of the building with some wonderful experts from their facility. Like we have a psychiatrist coming. Her name is Dr. Cooper. We have others coming that are professionals in their field, and we have a lot of fun that is going to be had during that time. So your parents can stay. We're going to have things for them, young ladies. You know how we roll. It's going to be wonderful, fantastic. We are looking forward to hosting you. So please keep that date on your calendar. Join us, and we'll send everyone that was there last time. We're going to send you information this time so we can make sure that you register and you can come and be a part of it, and more information to follow. There's some one other announcement that I wanted to make, and I'm trying to follow it up here. You all know, and I hope that people know, that we have a dental clinic. Everywhere we go, people are like, huh? I don't know. I didn't know you had a dental clinic. Well, there is a dental clinic from the Harford County Health Department, and that is located in Edgewood. If it's on 2204 Hanson Road. These flyers, everything that we're talking about, will be able to be found on our webpage, and on our webpage and on our Facebook page. You can see that the services, their cleanings, x-rays, what is it? Fluoride treatments.
The words are small, but I just wanted to make it clear that everyone knows that this dental clinic is for children and pregnant women. So just so you know, the dental resources in Harford County are really scarce for adults, but this is for children and pregnant women.
Right. Thank you, Michelle. That's real important. And we wish that the services were, we could spread them abroad. But for those that have children and you're in the area and you didn't know this existed, you know now. And we want you to be able to utilize it. There's not just one on Hanson Road. There's also one on 1 North Main Street in Bel Air, Maryland. Their services are great. The hours are there Monday through Friday from 8 a.m. to 4:30 p.m. I know that you might not be able to see it that well. However, you will be able to see it if you go on our Facebook page or on our website, and that's Harford County Health, and you'll be able to find it on that website. And also, we've been doing a lot of things, and we are still trying to connect and partner with many other groups. I want to make sure that I make this last announcement. We have a pastor that is a part of our community advisory board, and he's written a book. I'm going to take this off. He's written a book, and we also know, and the reason why I'm going to share this about the book that he's written is because one of the social determinants of health is faith. People needing a stable place to fellowship, a sense of community where they can connect, and a sense of places that you can feel like connected. And so Dr. Marlon Tillman is a good community friend of ours, and he wrote a book for you all to enjoy, and it's also on audio. Here it is. You'll also be able to find this on our page as well. It's called Reimagining Discipleship. And as he's talking about leaving a legacy for our children, um, a lot of us sometimes don't know how to save money or the importance of leaving a legacy for our children or feeling so that we're capable of doing that. Well, his book talks about this in a new and engaging way. Here's a picture of him. He's on Audible, he's on iTunes. Um, there's his book. I actually like Audible. Because sometimes my ADHD symptoms, I don't want to sit there and flip through the pages. So what I do, I buy the book and I get it on Audible, and so it gets me to read through the pages quickly, so I can understand and take the information in. So there you go. Man, there's so much going on, Michelle. My goodness, it's enough to make anybody's head spin. But I ask and every one of you all to get in where you fit in. I don't want nobody to talk about, I don't know what's going on. You know, listen, there were some posts on our webpage, Harford County Health page, that got over 300 or 600 likes and comments. So I know people are watching our Facebook page. So when you see these announcements, then you need to try to make it a point to share it on your page, comment, or join us. Join us. We want you to join us. We're very passionate about what we do, and we're very excited to be able to host the Harford County and our residents in this manner.
Yeah.
So, without further ado, um, we're also inviting, just excited that along with American Heart Health Month, it is also important. We're going into the month of March, and we wanted to get her in here ahead of March. Corrie Reed has been with us several times in the past, talking about cancer prevention and talking about the work that she does with Upper Chesapeake Medical Center. Today, we're going to be talking about everything cervical health, cervical prevention health, okay? And so I'm going to bring on Miss Corrie Reed. And let me see, is she there? Let's see. And as I bring her in, give me just a second. I want you all to ask your questions, be attentive to what we are at, what is going on as far as cervical health. It is another silent killer, and I say that only because a lot of people don't always go to the doctors to find out what's going on with their health. So we're going to bring on Miss Corrie Reed, and she is our guest tonight talking about cervical care.
Hi, Felicia and Michelle. It's good to be with you again.
Hi, Corrie.
I am the nurse case manager for the Breast and Cervical Cancer Chesapeake, and we help uninsured and underinsured women get those cancer screenings they need.
Corrie, thank you so much. The last time that we had you on, you were talking about breast cancer awareness and the services that your office provides regarding that. Um, and that particular show went over very well because we were talking about information that was more personal to us. You know, checking your body when something doesn't feel right. You know, we talked about the services that Upper Chesapeake Medical actually has for patients. And so tonight we're going to start out with some questions. And the first one is very basic. I mean, the very obvious, but important. Could you tell us what is cervical cancer?
Sure. So actually, let's start with the definition of the cervix. One may be aware of what exactly the cervix is. So the cervix, it's a plug of tissue that is the opening into the uterus between the vagina and the womb. And when that area begins producing abnormal cells, that is when cervical cancer, just like any cancer, is the abnormal production of the area of the body.
Thank you for that. And I'm hoping that people can kind of, hopefully imagine what that's supposed to mean for them.
The only thing I can think of is when I was pregnant and they had to check your cervix to see how many centimeters you were dilated. That's all I know. So thanks for giving me that clarification.
Of tissue, the baby out.
Okay.
But
gotcha.
It's
Say that one last time. Just say it again. I know we're having some issues, but we can still hear you.
So the cervix is that ring of tissue that does expand when your body is ready to. So they will, like you were saying, Michelle, that's the piece of tissue they check to see how the baby comes. Generally, it's very small. It's a small part of the tissue of the body that needs to be checked, routinely screened, producing abnormal cells.
Okay.
Thank you for that. The next question we had for you, while we're talking about cervical cancer, what is HPV and how do you get HPV?
So it stands for the human papillomavirus. So a lot, some of you have seen perhaps commercials for medication for, say, or something like that. HPV does cause genital warts. It causes several strains of HPV that are very dangerous to the human body, ones that will start. It is what causes your body to can develop into cancer. What a lot of people aren't aware of is that it causes over 90% of cervical cancers. It's not just cervical cancers. It causes it can cause cancers of other parts of the genital tract, vaginal, cause cancers of the penis, of the mouth, of the throat.
Wow.
And are caused by the HPV virus.
Wow. Wow. So because the reason why we asked what HPV is, and so someone might be wondering, why did we jump from cervical cancer to HPV? It's just for that reason, because it's not just concentrated in one area. It's going to all different types of areas for men and women, for boys and girls.
Yes, it's not just HPV causes significant in women with cervical cancer. As research and study has gone on, they've realized it plays in throat cancers, tongue cancers, and things like that. To acquire HPV is multiple sex at an early age, having other sexually transmitted diseases such as chlamydia, gonorrhea, HIV, or AIDS, and this feels so thrown in, smoking. All of because HPV is transferred through bodily fluids, you can see why it would cause all these different kind of cancer. The cancer of the cervix. But again, if someone participates in cause the tongue cancers, the throat cancers, is if they happen to a strain of HPV that is dangerous as far as cancer.
Wow.
So is this why they offer that vaccination, the Gardasil, at like 13 years old, because when they told me that about my daughter, I was like, wait a minute, no. So is that why they want to start it early enough?
I have
Say that
because
again.
absolutely, I have that on my list because this is one of the only cancers we can actually prevent. We can get with the
Hmm.
HPV vaccines, and it is approved for ages 45. A lot of pediatricians will give it to teenagers between the age before they become sexually active.
Hmm. You know, that is amazing that you said that. So I know that we can hear you. It's lagging a little bit, but I want to reiterate HPV is spread through bodily fluids. Okay, that's a cancer. So if you have multiple sexual partners, you need to be vaccinated for HPV. If you're smoking, if you're a smoker, is that what you were saying?
So smoking and multiple so smoking, and it breaks down your body's ability to fight any sort of virus. Or 80% of the population will have an HPV strain at some point in their life. Them the body clears them out, no problem. Most of the time, you never even knew you had it. Not all dangerous strains, but if the virus stays in your body long, on your cervix long enough, that's when it starts changing that.
So,
Oh.
right, if the strand stays on your cervix long enough, that's when it's going to develop cervical cancer or the
Hmm.
HPV.
It
So, mhm. Say that one more time.
begins changing the cells.
Oh, it begins changing the cells.
Hmm.
So yeah, Michelle, I was thinking the same thing when it first came out and they told me I had to give my daughter a shot for vaccination. I was apprehensive because I was just like, oh no, I'm
Right.
not giving her a shot at 13. You all go first and let me know
Right.
how that works out in a couple of years. And then I'll
Right.
circle back around. Then I'll give her the shot because I have three girls. You know,
Yeah.
you don't want to leave it to chance. You see, hear so many crazy things. Well, I could say my daughters are 23, 22, and 13 now. And so thankfully, I haven't had any side effects that I have known of from them in regards to that particular vaccine. So they do keep up with it. But I was leery too, Michelle. I was like, I don't
Yeah.
know.
And Corey, you said up to 45. So after 45 is just too late. You can't get it.
It's not necessarily too late. The FDA approves different vaccines, different medications, and their recommendation is that it only stages is when it should be used. If it's something you're interested in, your doctor, um, he can he can still give it to you if you're over 45.
Oh, okay. Because I was about to say, I'm 42. Let me go run and get that right now because that sounds horrible.
Look, I'm
Well,
50, so I'm out of luck. I don't know. I don't know if I have.
what's so though is that this is a cancer can actually we can actually keep this cancer from developing.
Okay, that's good to know. That's good to know that they can
Okay.
proudly give a definitive about that. So that's good. And also our next question, I think we did answer this. So how is it diagnosed?
So it's diagnosed generally when you go for your pap smear. Um, the gynecologist or the nurse practitioner checks checks your vagina, checks your uterus, presses on your ovaries, but they also use this kind of helps open up the vagina so they can put in a small swab broom or a scraper. And what they do is they take a few cells from your cervix and they pap smear and the HPV test together to the lab and run with your regular routine pap smear.
You know, and I found out that depending on your insurance, they don't give you pap smears every year. I think they're starting to stretch them out. And so I
So
wonder. Go ahead.
you don't. So, and I can explain that because I get a lot of questions about that of, okay, how come I get my, but not my cervix? And HPV is a slow changing virus on the cervix. So if you get just a pap normal, you don't have to come back for 3 years. If they run a pap smear and both of those are negative or normal, you don't have to come back for 5 years to get. Now, if you have some abnormalities, it doesn't mean, or you're HPV positive, that you have cervical cancer. It doesn't mean you have to go immediately to some sort of treatment. What it does, keep a closer eye on it. We may do 1 or 2 other procedures and tests to make sure it's, but we shorten that length of time that you need to come back and have another PAP done.
Okay.
We're going to have to write that in the chat because I'm thinking I see my OBGYN once a year and they do the regular PAP. But I never asked if they were checking my well, I guess he would, check my cervix too each time. But you're saying it's not necessary.
Well, it depends on what your history of. Some women have normally abnormal cells, and so they generally, like every year. And with the PAPs, you have abnormal cells. They can also do a reflex so that if it comes back, hey, there are some abnormal cells, they can and run the HPV to see if it's HPV that's causing it. It isn't always HPV positive unless it's more advanced than they would expect. Let's say a PAP and they haven't had a PAP in 25 years. Well, during that time, they're because of HPV. So they may need to have more done to take out those cells. However, if you've been routinely getting your no problems or they're monitoring you closely, if it comes back abnormal, they go to some sort of procedure. Because HPV changes cells so slow, come back in 6 months or come back in a year, or sometimes even 3 years together.
Okay, so that does make sense. We're still going to put that information in the chat just in case anybody needs some more clarity about that. Just a small program note, it is really important that if you have not been to your OBGYN, make an appointment. Let March be your month to really keep on top of your health in this area. It is just that important that we are taking the entire month to bring awareness to our health in this regard. So thank you for that answer. Then let's say you have cervical cancer or MPV or some because of the MPV. What
HPV.
HPV? Thank you, Michelle. I'm getting ready to say most valuable player over here. Now you know what I am. I need somebody to help me. Well, I'm saying if you have an MVP, I'm sorry. And we're not taking like for anyone that might be diagnosed with this. We just like to laugh, I'm sorry. So, what treatments are available?
With if you're HPV positive and you continue to have abnormals yet into cancer, we don't want to wait for that to happen. So for a certain period of time and you've remained abnormal or the abnormality has increased, they can do several procedures to cut out that area of cell. It's called well, they're complicated, but it's like a looped wire that they can use to take out those cells. You don't want to do major surgery, so they go from least invasive to most invasive depending on the diagnosis. Just a colposcopy. Hey, these came back abnormal. Let's do a biopsy. Let's do a tiny piece of the cervix to see if it is cancer, or if it is not rapidly, but is developing into cancer. If that's negative, then they will just recheck you every 6 months to a year, depending on who you see. It's positive, not necessarily for cancer, but for cells that are more abnormal than they expected. They can go in and basically, which keeps those cells from developing into a cancer, and then you frequently to make sure they got all of the cells, to make sure it's not changing. Say you do come back with a cervical cancer diagnosis. At that point, you have a procedure and potentially chemo. But again, with routine pap smears be entirely avoided. Like we like to say here, no one in the U.S. should ever cancer. Women in the past, before pap smears, it was a routine cause of death. It was frequent. It was no one
Say it
in
one
the
more time. Say it one more time, that last part. It was a killer? Is that what you said?
It was a common killer of women. It was one of the top, and it was you perhaps know of Henrietta Lacks, of potentially her story, and if you read her story, you know a painful cancer. Women no longer need cancer. With routine pap smears, they can catch it before it ever even reaches the stage of cancer, because we can remove those cells and we can monitor frequently.
Before you go too far, I want to make sure that people can understand what you're saying. And so routine pap smears has all but eliminated the fact that you would get cancer on your cervix or in those parts, because they can remove the cells right off of the cervix. So this is why it's so important. Now, you just mentioned about Henrietta Lacks, and the fact that when she was in the hospital with the cancer that she had, it's extremely painful. And Corrie Reed also mentioned the fact that many women back in those days were dying at rapid rates because they did not have the right treatments. Now it is available. And so those were part of the questions that we had. Please go and see your OBGYN. If you do, go ahead, Michelle. I know you have a question.
No, I was going to say, and the most important part that you just mentioned was that it's painful to have to deal with the cervical cancer, opposed to just going and be tested and having to do the biopsy and all that stuff. That's the minimal part of the pain, opposed to having to go through the excruciating pain that a cervical cancer can cause. So like Felicia is saying, get out there, go get checked. And this is also pushing me, because I'm supposed to go get a mammogram. But every time I hear someone tell me how it hurts so bad, I'm like, all right, I've been pushing it off.
Michelle, there's too much hype. I think it's too much hype. It's just uncomfortable.
But when I think about it,
Corey's trying to. Go ahead, Corey.
I just had my girls are still intact. We're okay. You go get that mammogram.
I am, because I'm just thinking about it. It could be worse to actually have an issue and have to go through more pain than that. So I'm definitely going to go ask for another referral because it's probably expired. This is why I'm here, so that I can learn some
Go,
things as
go,
well.
go, 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 go.
There
It's just uncomfortable. I've been going since I was 40 because of the
yes.
history of breast cancer in my family. And it was just one person, was my nana. And
Hmm.
so I didn't want to go because I kept hearing that it's going to smash your breasts and all that other stuff. And let me tell
Yeah.
you, it is uncomfortable, but it doesn't last. It's not really a long procedure. It's just basically going, putting your breasts up there. They guide you through the whole process. They make sure that you're ready when they're ready to push down the machine. Michelle,
Hmm.
go ahead and do it. I just had
I'm
my
going.
OBGYN appointment, my daughter and I'm waiting for my other daughter to get hers because it's just that important. Um,
What
go ahead,
women
Corey.
know, what women may not know
Hmm.
is that they, they can imaging centers, um, and they can be a self referral. They
Hmm.
don't have to have a doctor's order. They can go for their screen. They my screening mammogram this year,
So you can do
and
self referral, Michelle. Is that what she's saying? So even if it's
Okay, so I don't
expired, you
have to
can
go
just
back and tell my
you,
doctor how my dog ate my.
right.
those,
Don't tell them that.
those referrals good for about good for about 6 months.
The referrals are good for 6 months. That's fantastic.
Did she say
So
six
you did
months?
answer. This referrals
Okay.
are good for 6 months. And so the reason why we were backed up is because during the pandemic, I think we all just kind of fell off the wagon of making these appointments, or we were doing. Listen, we was doing some of them telehealth appointments for mental health, but we weren't
Hmm.
physically going into the doctor getting checked for our
Hmm.
OBGYN.
A lot
Go ahead.
closed. You couldn't go, and as it has, and we have found cancers that were missed because people either couldn't get into their doctor or they were afraid to go into any COVID. So the pandemic
Yeah.
has negatively affected cancer treatment in the country.
Isn't that something?
Yeah.
Think about that. There are people, so we're healthy, right? But there are people that miss appointments because the offices were physically closed. There was no way to get in there. And then they miss those diagnoses
Hmm.
of having cancer. So when we think about the people say that the pandemic is behind us, the residual effects of what's going on right now lets us know that we still have quite a bit of catching up to do for those that weren't as fortunate with those appointments and important diagnosis. So if this is you
Yeah.
while you're listening, please do yourself a favor and get out there and get checked. Let me see what the next question is. You did answer what are the treatments for cervical cancer? Um, I don't think we asked you what are the signs and symptoms of cervical cancer? That's a good lead in.
So the signs and symptoms of cervical cancer, it's a late sign. That means it is far more advanced than we want it to. When I tell you these signs and symptoms, you're going to be like, but that could also be a yeast infection. This. So the signs and symptoms are vaginal bleeding after having sex, vaginal discharge with foul odor, pelvic pain during sex. These signs. However, these are also signs of, say, a yeast infection, types of medical issues. So if you're
Hmm.
having that, you should go see a doctor, um, because you need to get it treated, whatever it is. However, as far those are very late signs
Mm.
Wow. So
that
going
would
through that again,
be
you
advanced.
said foul discharge, bleeding after sex or during sex?
Um, bleeding after sex and pelvic pain during sex.
pelvic
Mhm.
pain during sex. And you also just said that means that it can also sound like you're having just a regular infection, or say that one more
It could
time.
be it could be a different type of sexually transmitted disease. It's whatever it is, you need to get it checked. But as far as cervical cancer is concerned, for cervical cancer.
Mhm.
So if you have any of those symptoms, just flat out go to your OBGYN.
Go to
Because
the
that's
OBG.
the
That's it.
yeah,
Period.
period.
Period. Just go.
Period. And don't feel afraid or ashamed. Just know
Mhm.
that your health is important. At the end of the day, you live with you. And
Yep.
so don't feel embarrassed, don't feel ashamed, or I waited too long, or it's too late. Don't get scared. Just know that once you get on the other side of that threshold, there are people there to support you, to take care of you. And you have to understand you have family and friends that love you. You are valuable. And you should go and take that very seriously. If any of those symptoms are going on, please go and get yourself checked out ASAP. Let's march forward. Let March be your month to get yourself all the way back together. Let's get our women's health all the way back together. Let's get back
How about
on track.
march yourself to the doctor. Let's march
March
our way to
yourself
our doctors.
to the doctors.
I may have to
Yes,
use
right. Say that again, Corey.
that. March yourself into the doctor for some sort of
Yes,
advertising.
Yep.
march yourself right on in to the
Yep.
doctors.
How
That's
they
a
say,
good
come on
one.
in, the water's fine.
The water's fine.
Well, and
It's your time.
Felicia, you live with you, and I would add to that. I would say you live with you in your life that don't want to live without you, and
Ah,
part making sure you're okay.
hmm.
Yeah.
Yes, and your family and friends don't want to live without you. That's what Miss Corey Reed said. So please, we're going to say this every show. Every time you see me, every time we're at our monthly meetups, I'm going to let you know how much we love you, how much your family loves you, and how important this is. March yourself right on in there. That's what we're going to say. We're going to put it on a shirt, put it on a pin. March yourself right in there to the
Yep.
doctors. Right there. Our next question for you, I think that we're almost there. We're almost to you did answer the question. This is absolutely 100% preventable with an
Yes,
OBGYN appointment.
HPV vaccine,
Um,
regular Pap smears. This can be prevented.
Yep.
yes,
The
with regular
vaccine.
PAPs.
Don't
Go
forget the
ahead.
vaccine.
The
Yep.
vaccine, get the vaccine. So if you were like Michelle and I, and you were kind of leery at the age of 13 for your own daughters, um, get it done. We did
And
it.
not just
Say it again, Corey. We missed that whole thing.
daughters, your sons need it too, because again, just a reminder, HPV causes cancers of the penis, rectum. It can cause throat cancer, tongue cancer. It's
Mm.
not just for the girl, for the boys.
I'm glad you
Yes,
clarified that. Everybody.
it's for everybody,
Everybody.
boys and girls.
Mm-hmm.
Boys and
Yep.
girls is too because of the fact of just what Corey said. And we'll reiterate this information that she's given us, and have if you have questions about it, we'll make sure you have those questions answered. Um, are there any genetic risk?
So very, very rare. Again, HPV causes over 90% of cervical cancers. Rare types that can be caused by two genetic abnormalities, but it's extremely rare for that to be the case.
Okay.
Mm.
All right. So at what age should, okay, we already talked about this. What age should one begin screening for cervical cancer? Well, no, we
So
didn't really answer that question.
didn't we didn't. If you look on a lot of the health websites, they'll say 21. I would say if you're sexually active at 18 to go ahead and start. Then I would just start at 18. Um, Otherwise, a lot of women will start.
Yeah. And I'm gonna just keep it real while we on the air. If you a teenager like I
Mm-hmm,
was 16 and pregnant, you need to go and get
mm-hmm.
screened. So
Hmm.
we know we're gonna just address that now because there's teenagers that are doing things that adults do way before 18. So if you know this about yourself or your
Long before
children, go get them screened, tested, vaccinated.
Right. We don't want their
the
error in judgment to cost them their life or the life of
Right.
somebody
right
else.
Yep.
Absolutely.
and the HPV vaccine, you can start as early as 8, um, just to get it out
18.
of the way.
Yeah.
Mm-hmm.
But teen population, the HPV vaccine is the most effective way to prevent cervical cancer.
Say that one more time, Corey.
For the HPV vaccine is far and away the best way to prevent cervical cancer.
That's so good. Corey, let me tell you something. You then laid on a lot of information for us today. I'm hoping that the listeners found value in what you were saying because I certainly did. Um, you even sent us some flyers, and we're going to put those flyers up and read them off. The first one, I really, let's see, where is it? Where is it? Where is it? Where is it? Okay, first one is just a reminder. And so, Michelle, I'm going to take you off for just a second so we can really see it. Ah, this is why we need some extra hands in the set. And so I'm going to let you read this one. Okay, here it is. And so this one right here is don't forget Harford County Breast and Cervical Cancer Screenings Program. And so when Miss Corrie Reed comes back on, let me put her back on real quick and I'm going to get off. She's this is at Upper Chesapeake Medical. You can find this flyer on our webpage. It says cancer screenings save lives. That's all we talked about today for this last half an hour. And so you can get, he said, you may be eligible to receive mammogram, breast cancer exams, PAP, and HPV tests at no cost if you have some of the following qualifications on this flyer. Now, don't worry if you can't read it. We're going to put it on our Facebook page. And the other flyer, which I think is pretty cool, for the month of March, well, just for the month of March to let you know, is don't leave it to luck. Need your mammogram or PAP, but PAP test, but uninsured or underinsured. Here's a phone number. Call 443-643-3767 to see if you qualify for no-cost screenings. And I remember that Corrie told us the last time she was with us that most all insurances will cover a mammogram, and she can explain that more when I bring her back on the screen. But also, look, this is a phone number. Do not think that you don't have the money to do it, or you're underinsured and you have to pay something. Call this number, and you're going to talk to someone just like Miss Corrie Reed. If it's not Miss Corrie Reed, and she will and her team be able to assist you. So again, I'm going to pull my coworker back on. And I'm going to take this flyer off. I
The
want
main word to this is that it's free. It's
oh,
free.
it's free.
That's what
It's
catches
free.
my attention the most. It is free.
And also, again, Miss Corey had a skedaddle. She was hopped off, but we want to, in her absence, thank her for being
Yes.
on with us. If you have any more questions about cervical cancer, HPV, mammograms, pap smears, we had the expert on tonight. There's flyers on our Facebook page. We can leave you the information. If you need any help, Corrie Reed and her team, you can see her email is has been running at the bottom of the screen for our entire segment. So Corrie Reed is someone that you need to reach out to. Care about your health, care about your family. This is for boys and girls. Get your HPV. This is for preventable cancer. Preventable cancer is the highlight. That's the main word, preventable, right there.
Mhm.
So, Michelle, did you want to add anything else?
No, that's it. You've said it all. I
Oh,
mean, this was a lot. This was some really good information.
excellent
It
information.
gave me more insight of what, cervical cancer is and the HPV. So, and I'm pretty sure there's people on the other side looking and saying, "Oh, I didn't know that." And like you said, it's preventable.
It's
That's the
preventable.
main thing. That's the hope for anyone that's out there, that it's preventable, and if it's caught fast and early, that it can be taken care of. So get
Yes,
out there
yes.
and march to your doctor.
Get yourself in there. March
In
your
there.
way to the doctors.
Yep.
March your way. Get on the cell phone. Google it. Get on our page. March, march, march.
Yep.
So, listen, thank you all so much for joining us. We look forward to the next couple of shows. And this is another segment of Let's Talk About It. Have a good evening, everybody.
Good night.
Good night.